Good day. This is Dr. K Gireesh, physician, neurophysician and neurosurgeon. Welcome to RNA series 18. RNA series is nothing but random questions in neurology and neurosurgery with answers by me, and that is Dr. K Gireesh. This is to benefit the practitioners of neuroscience and the medical field, and for a lifelong learning, and also for public awareness. Here, the question which I am going to address is, what is Parinaud's syndrome? Parinaud syndrome, also known as the dorsal midbrain syndrome, is characterized by a group of eye movement abnormalities and other neurological signs resulting from the lesions in the dorsal midbrain, specifically the pretectal area of the dorsal midbrain. This was described by Henri Parinaud, who was a French ophthalmologist. He is known for his contributions to neuro-ophthalmology, particularly his work on eye movement disorders and their neurological underpinnings. Now, the clinical features of Parinaud syndrome includes upward palsy, inability to move the eye upwards, upward gaze palsy. 1. 2. Convergence retraction nystagmus. During attempted upward gaze, the eyes move inward and retract. Light near dissociation. The pupils, they respond to near stimuli, accommodation, but not to light. Lid retraction, that is called Collier's sign. The upper eyelids are retracted, giving a staring appearance. That's the other one. The fifth is a skew deviation, misalignment of the eyes vertically. And sixth is a convergence spasm, spasmodic inward movement of the eye. These are all the features of Parinaud syndrome. 1. Up gaze palsy. 2. Convergence retraction nystagmus. Light near dissociation, lid retraction, 5. Skew deviation, and 6. Convergence spasm. The causes of these are tumors in and around the pineal region, pinealoma, germinomas, and other midbrain or pineal region tumors, vascular lesions, stroke or hemorrhage in the midbrain area, multiple sclerosis, demyelinating plugs affecting the midbrain. 4th are infections like neurocysticercosis, tuberculosis affecting the central nervous system. 5 is trauma, a direct injury to the midbrain. 6th, hydrocephalus, increasing intracranial pressure affects the midbrain. So it can be due to tumors, vascular lesions, multiple sclerosis, infections, trauma, hydrocephalus. These clinical features arise due to damage to the structures in the dorsal midbrain. If you take this as the brain stem, you find here the medulla, the pons, the midbrain here. So in the dorsal midbrain, the oculomotor, 3rd and the 4th nuclei, they are getting damaged, as well as the vertical gaze center is also situated here. Treatment involves addressing the underlying cause, whatever it is which I have enumerated, which might include surgery, radiation therapy, medical management of the infections, or the management of multiple sclerosis, a demyelinating illness. Well, I have explained to you Parinaud syndrome, described by Henri Parinaud, a French ophthalmologist. I also told you about the clinical features the 6 features of Parinaud syndrome, and also I told you about 6 causes of Parinaud syndrome, and also I have said the mechanism of why this vertical gaze palsy occurs. That's in brief on Parinaud syndrome. Thank you very much.